Now, when a patient suffering from bulimia nervosa walks into your clinic, how are you going to diagnose that? What are the clinical features that are going to lead you into the diagnosis of this particular kind of condition, which is known as bulimia nervosa? What are the characteristic features? What is the symptomatology? What particular or peculiar history the patient will usually give you? What is the thought form of that particular patient? That we'll be discussing over here in this section that is based upon the symptomatology revolving around this condition, which is known as bulimia nervosa. Usually, as the definition indicates, we'll be looking forward towards those binging and those purging episodes, which are the highlights of this condition. The binging episode is usually characterized by the consumption of large amounts of food in a very short period of time, and after that, there will be a purging episode that is usually characterized by induction of the vomiting or by self-administration of diuretics and enemas. Now, after taking all of these diuretics and enemas and administration of these vomiting episodes, the person will have the side effects related to that. So we'll be looking at the whole body of that person. All of the systems of that particular person are going to be affected. The respiratory, along with the cardiovascular system, the skin of that person, the gastrointestinal system, all of these will be affected due to these binging and due to these purging phenomena. The head-to-toe examination of these individuals is again very important, and they'll give you important clues towards the diagnosis of this phenomena, which is known as bulimia nervosa. Again, the history taking is very important. Just to highlight the factors, the childhood history is again very important while we are taking it in detail. You'll have to have the history of any trauma or abuse if he has suffered in the childhood, or if he's suffering from any comorbidities that may or may not be related to this particular kind of an eating disorder that we're dealing with over here in this section. Regarding the sign and symptoms, obviously I've already emphasized on the fact that the head-to-toe examination is very important. All these systems will be affected in this particular individual. He'll give you a detailed history about the binging and the purging episodes. The person will usually seem dehydrated. The muscles will be fatigued, and all of this emaciation is going to be because of the fact of the food restriction that he usually goes through. So there'll be episodes of restricted diet, there'll be episodes of binging that is going to lead into the ulcer formation, into the diarrhea, into the constipation, and all of these phenomena are going to be seen in this particular individual. So a complete history, a complete physical examination, the vitals of the person will give you a low pulse, low blood pressure, and all of these are going to be the highlights of that particular physical examination that is going to lead into the diagnosis of this condition. The ICD-10 criteria will basically simplify this and will give you the characteristic features or the specific features that we look for after the general physical examination is done. The binge eating is going to be looked for in the history even. So the socioeconomic history, the cultural background, the personal history, the past medical and surgical history, all of these are the important components of history taking while we are working on this particular kind of a eating disorder. The psychiatric comorbidities have to be looked for if he's suffering from depression, anxiety disorders, mood disorders, schizoaffective disorders. We have to look for these psychiatric comorbidities because of the fact that the treatment plan or the treatment modalities would lie upon these comorbidities, and even the outcome, the prognosis will depend upon these comorbidities. There will be a very nice prognosis if the person is not suffering from any particular serious comorbidity, or if he's suffering from any particular comorbidity, then the outcome can be poor as well. So over here in this section, we'll be summarizing the signs and symptoms that we're looking for in this particular individual. The clinical presentations are 10 times more in females. So usually the female population is more affected in this case, but obviously, nevertheless, we're not going to ignore the male population. Even the childhood and the adolescents are affected by this kind of an eating disorder. They are rare in the childhood, but still there are a lot of cases that are observed. The average age of onset is usually after 18 years. The majority are assessed and managed in the primary care as well. Now, all of these risk factors that we've already kept in our mind, for example, the physical, for example, the cultural, the socio-economic, these risk factors and the personality traits of that person has to be kept in mind after we have taken the complete detailed history of that individual. Now, after the preliminary history has been done, the personality traits have been recorded, and the childhood history has also been recorded in that particular individual that we're talking about. The past surgical and medical history, if he's suffering from any ailment or any terminal ailment, for example, Hep B, C, or HIV, all of these terminal illnesses have to be recorded if the person is suffering from them. Then the psychiatric comorbidities have also to be kept in mind, and if they are present in that particular individual, they have to be documented as well in quite a detail. And after this preliminary history, we'll be moving on to the systemic history. Moving on to the gastrointestinal system, the dental erosion. First of all, we'll be starting off with the oral cavity. We'll be looking for any dental erosions. We'll be looking for the salivary gland. We'll be looking for the hypertrophy, esophageal tears, bleeding, abdominal distension, and constipation. And there will be a raised serum amylase after the laboratory investigations have been carried out in this particular individual. So when we look at the signs and symptoms in general at the gastrointestinal systems, this is basically highlighting the fact, or this is basically highlighting the side effects after the binge eating phenomena. The consumption of large amounts of food in a very short period of time is going to cause this abdominal distension. And as we've already mentioned, there is a psychopathology, the self-restricting phenomena to stop the person, the self-regulatory phenomena to stop, basically, which stops the person from eating after he's eaten enough amount of food. But in these individuals, it is not inhibited. The person is not inhibited and he keeps on eating the food, and that is basically going to lead to the abdominal distension, the ulceration phenomena, and subsequently the constipation. Moving on to the kidneys, the renal system is examined in detail. And what basically we come across, there is going to be an edema, that is the swelling. So swelling can be on the face or even on the dependent parts of the body, that is the legs and the feet. Electrolyte imbalance is also observed in these individuals. There will be hypokalemia and hyponatremia observed in these individuals, and then the person is going to be dehydrated as the loss of water after the purging phenomena, which is the induction of the vomiting. He's going to lose large quantities of water and he's going to be dehydrated. Working on the cardiovascular system, we'll be moving on to the arrhythmias and the sudden death in these individuals. So there can be arrhythmias as well as the low pulse and the low blood pressure. And even these arrhythmias can be fatal for that particular individual that we're talking about. Then the neurological signs and symptoms are again very important over here. The patient will give you a history of seizures or the peripheral neuropathies as well. Tetanizing features are sometimes also seen due to the calcium depletion phenomena. The person is basically not taking enough diet, or even if he's having those binging episodes, he's not taking the right quantities of nutrients. That is, the balanced diet is not observed in these individuals. He's not taking the correct carbohydrates, fats, and proteins, and vitamins and minerals that he's needing. So the calcium depletion is going to lead into a tetanizing condition, and peripheral neuropathies are going to be seen due to the fact that the vitamins are also going to be depleted in this particular individual. So moving on to the ICD-10 criteria for bulimia nervosa, there is going to be a preoccupation with eating and craving for food. So one of the criteria is the food-loving phenomena that is usually seen in these individuals, and then the patient is going to attempt to counteract the fattening effects of the food. For the counteraction, he is going to induce vomiting, he's going to take diuretics, he's going to place enemas, and all of these are an act that he's trying to get rid of that food. After that, we'll be seeing the self-induced vomiting or laxative abuse that is noted down in these individuals, the alternating periods of starvation or medications. There's going to be periods of the restricted diet, and that is going to highlight the fact that the thought form of that individual is that he's basically restricting his diet to lose those extra pounds that he thinks that he has gained, but obviously that is just a delusion that he's suffering from. So the morbid dread of fatness is again there. He's going to fear the fact that he's going to get fat or he's going to gain a lot of weight. So this morbid fact or this morbid fear is going to be a part of his thought form or is going to be a part of his thought content, and that can be revealed quite easily when you take the history in a detailed way. There's going to be a strong desire to be unhealthily thin. So it's again one of the phenomena that is seen in these individuals as well. Now, how do you basically define that binge eating episode? The consumption of excessive quantities of food over a period of less than 2 hours. So there is a time duration that is specified in this binging episode definition. 2 hours is the time period for that person to take that correct amount, to take that large amounts of food, which is coupled with a subjective feeling of the loss of control. So the person basically has the feeling that he's lost control and he cannot stop or he cannot inhibit himself from eating further. So that is going to be the presenting complaint of that person who is suffering from this kind of a condition. He may or he may not have insight to the condition. He may think that he's not suffering from any psychiatric condition, but still he will have the insight that he cannot inhibit himself from eating. Usually the kind of food he takes is a high calorie food, and the relief from feelings of tension is usually observed by the person as well. He feels happy after having eaten those large quantities of food. The feeling of disgust and guilt is followed after this binge eating episode. The psychiatric comorbidities that usually exist in these individuals are depression. The person can suffer from depression. He can suffer from anxiety disorders, social phobias, and as well as the obsessive compulsive disorders as well. So these are the usual psychiatric comorbidities that we see in individuals suffering from bulimia nervosa, as well as the person can give you a history of alcohol misuse or any other substance misuse as well. So usually there is a history of substance misuse or addiction phenomena seen in these individuals. There is a self-harming behavior. So the deliberate self-harm, which is also abbreviated as DSH, we can categorize these eating disorders in those DSH criteria. These are the deliberate self-harm phenomena, and one of them are the eating disorders known as anorexia nervosa or bulimia nervosa. The impulsive type personality disorders are usually seen in these individuals, as the person can be even an OCD, that is the obsessive compulsive disorder. So in this section, basically, we highlighted the symptomatology that usually revolves around the people suffering from bulimia nervosa. So that is the end of this section. Thank you for watching sqadia.com.